Well, as the 20th anniversary of the brutal genocide that killed at least 800,000 people nears, Rwanda is often cited as a model country when it comes to improvements in healthcare, the environment and economic development. Rupa Gogineni takes a look at some of the country's successes.
In a checkout line at Kigali's Nakumatt shopping center, employees pack groceries in paper bags. After non-biodegradable polythene bags were banned in 2008, owners found that stocking plastic in their stores carried a risk of going to jail. The ban is part of an environmental campaign that has earned Rwanda the reputation as the cleanest country in Africa. Another hallmark initiative is Umuganda, a mandatory day of community service held on the last Saturday of every month. Adan Ramata, the Nakumatt store manager, comes from neighboring Kenya.
Before, when Kenyans will visit Rwanda, and you tell them tomorrow is a national cleaning day and we have to clean, they will ask you how much do they pay, how much do they pay? Then you tell them, no, this one is just a national cleaning day and you just have to sacrifice and you have to clean.
Rwanda's government has also made sweeping reforms in the healthcare sector. Rwanda, like many African countries, faced a healthcare system that was heavily centralized in urban areas. In recent years, the Ministry of Health has pushed to establish district hospitals for its rural citizens, around 80% of the population. The country is also widely recognized for a national health insurance plan that covers nearly all Rwandans. Dr. Bwiza Muhire Hippolyte is a general practitioner at Butaro Hospital in northern Rwanda.
When patients are insured, they consult area. They don't come when they are severe ill. They consult area. Many times ago, people were delivering, for example, at home. If the delivery is not attended, there is a very high risk of having serious complications. Even some mothers can die.
Dr. Hippolyte says that today, nearly all deliveries are attended to by healthcare professionals. Universal health insurance, he believes, has brought down infant and maternal mortality rates. Rwanda's healthcare successes were largely made possible by foreign aid money, which covers half the cost of the national health insurance program. Rwanda's rapid development is not without its critics, who say the government is heavy-handed and does not stand for opposition. But there's no denying Rwanda's economic growth stands out in the region. GDP growth has averaged 8% per year over the past decade. Poverty reduction has been a top priority of President Paul Kagame, who says he wants to push Rwanda to middle-income status by 2020.
In the past, there was always a term used, you just call it reducing poverty, as if the aim is to remain with some poverty.
At the time of the genocide, 78% of Rwandans lived in poverty. Today, that figure has fallen to less than 50%. Rupa Gogineni for VOA News, Kigali.